Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing the impact of compression therapy on wound healing. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So what is compression therapy? So compression therapy is the gold standard in treating patients with venous disorders and lymphedema. So compression therapy involves either stockings or devices that provide a sustained or dynamic pressure to the lower legs. So the pressure applied helps the venous return, so the blood flow back to the heart. Now, the degree of pressure needed for the patient is going to depend on comorbidities, diagnosis, and the patient's ability to withstand the pressure. So we always have to do an ABPI, so an ankle brachial pulse index, before compression is ever applied. This ensures that the legs can withstand pressure, okay, and that you're not going to do damage. Because a lot of times we can see venous disorders and we have a lot of swelling, edema that comes with it, but you can also have arterial issues and have a mixed disease. So we have to make sure that the legs can withstand the pressure. Normally, the pressure of 30 to 40 can be very sufficient in treating capillary hydrostatic pressure in the lower limbs. But once again, we have to make sure we may need a lower compression. And it is also very, very essential that the health provider does receive proper training before ever applying compression therapy. Improper applied compression can really interfere and damage the healing process, okay? And it can do more damage to the wound. If we put too much compression on that wound and on that leg, we could be cutting off circulation and therefore causing more damage to that wound because it's not getting the nutrients, the oxygen that it needs to heal. So how does compression therapy improve wound healing? So properly applied compression therapy is very highly successful at promoting healing, okay? We're moving the fluid that's pooling at the bottom of the legs, moving it up so our skin isn't stretched out. It's going to allow those wounds to heal. So how compressions, what they actually do is they increase the venous return. So the move of fluid back up to our heart, okay? Without compression, the blood is having a very hard time moving back to the heart. So that's why compression is for life once you're diagnosed with this. Now, it also improves lymphatic drainage. It helps tissue remodeling. There's a release of anti-inflammatory cells. There's decreased pain. When we have wounds and a lot of edema, a lot of swelling, it causes a lot of pressure on that wound, causing pain, okay? So once we get the fluid moved back up, it's going to decrease the pain. It's going to allow those wounds to heal because there's not that pressure. Because how when we have venous disease, normally in the morning our legs are smaller because we've laid down all night and the fluid has gone back up, processed through our kidneys, go out of our bladder. Now, throughout the day, when our legs are in a dependent position, the fluid starts pooling. That means our legs are once again swelling. So we have this constant in and out, in and out, in and out. It's causing more damage to the wound. If we have venous disease with swelling, it will be extremely, extremely difficult to ever have wound healing if we're not using compression therapy. So the strength of compression is going to differ at different phases of treatment, okay? So there is two different phases of treatment, decongestion phase and maintenance phase. And the strength of the compression should be adjusted according to the patient's symptoms, okay? So in the first phase, the decongestion phase, this is where we're trying to get the leg swelling to go down, okay? Reduce local edema and improve circulation at the wound site, okay? This will need a stronger compression, okay? And because the legs are so swollen, the fluid is looking for an out, okay? So the fluid is going to come out of that wound because it's looking for somewhere to go when we have so much swelling. So during this phase, while we're trying to get the fluid off the legs, the wound is going to be exudating heavily. So during this phase, dressings may need to be done daily. Okay. Now, during the maintenance phase, the main goal of this treatment is to avoid ulcer reoccurrence. Okay. Edema and the swelling caused by venous insufficiency causes these ulcers. Okay. So we're trying to prevent ulcers from reforming, prevent that edema from happening, okay? As the edema subsides during this phase, compression therapy should only be strong enough to prevent reoccurrence, okay? So we only need compression strength to be strong enough on that leg that the leg isn't swelling. So once again, there can be complications with improperly applied compression therapy. Okay, these are normally avoidable. So ischemia. This is where the ABPI really comes in handy because we should never be applying compression to someone who we haven't done an ABPI on, making sure that they can withstand the pressure that we are going to put on them. Okay, if the bandage is applied too tightly, it can cut off circulation and it causes numbness, discoloration of the toes. And if somebody doesn't notice this, okay, or they have loss of sensation in their lower limbs, they may not notice this and it can cause a lot of complications, okay? Even toe loss. It has happened. Now, pressure ulcers can also form from excessive pressure applied over bony prominences. So if somebody has a very bony shin, you may have to add additional padding to that area. And then contact dermatitis. This could be an allergic reaction to some of the components in the compression therapy, okay? So we just have to be cautious of these things. So that's all I have for this video. I hope you did find it helpful and now you fully understand the impact that compression therapy does have on wound healing. And I hope to see you guys in my next video. Bye, guys.